Hello, my name is Timin Hosseini. I'm a student of nursing PNE 203. This is the room 360 degree. This is my ID badge from Seneca College, and now first I do my hand hygiene. I have done my clean gloves, and after donning my clean gloves, I will clean my stethoscope, and I will clean my stethoscope from the bell and diaphragm. Now I will introduce myself to my patient. Hello, my name is Timin Hosseini, a student of nursing. Today I want to do the head-to-toe assessment for you. May I check your wristband? Thank you. And what's your name?
William Overton.
Okay, and what's the date of birth?
May 7th, 1933.
Okay, after that, I will ask my patient for consent. Is it okay for you to do head-to-toe assessment? Thank you. Do you have any pain?
No.
Do you want to go washroom? Because maybe it takes 20 minutes.
No.
Okay, now I will check the privacy of room, and I will be sure about the safety of room for my patient. Now I will start with physical appearance for my patient. The skin color and tone is evenly in her whole body, and that is appropriate for his genetic background, and there is no unusual odor, and also the age is same as the age he stated. After that, I will check the body structure. Could you please stand up? Thank you. Sit down. Her body is symmetrical. There is no deformity, and also he is well nourished. The height is appropriate for his age. After that, I will do the behavior and check the behavior. He has a good and maintain a good eye contact with me. His facial expression is appropriate. He is in a good mood, and he dressed appropriately for this situation and weather, and personal hygiene is intact. After that, I will check the breathing work. Breathing work is effortless, and there is no distress, and also there is no shortness of breathing. After that, I will check the level of consciousness. He is awake, he is alert, he is not sleepy. What's your name?
William.
Where are you?
In the hospital.
Which month we are?
March.
Okay, he is orientation he has orientation to time, place, and person. After that, I will start with face. Could you please take off your glasses? Here his face is symmetrical. There is not any involuntary movement. There is not any scar. There is not any swelling or mass. After that, I will check the nerve 7 or facial. Could you please puff your cheek? Thank you. Could you lift up your eyebrow? Could you close your eyes tightly? Could you open them? Could you close your eyes and against my resistance, don't open them? Thank you. And could you please frown? Could you please smile? Could you please show me your teeth? Okay, now I see all of them are symmetrical, and it shows that the nerve 7 is intact. After that, I will check the eyes. For eyes, I see the eyebrows are symmetrical, and also I check the eyelashes. Eyelashes in both eyes and up and down are evenly distributed. I lid. I check, close your eyes, open them. There is no lid-like, there is no ptosis. And after that, I will check the sclera in both eyes. Sclera is white with pinkish vessels. And after that, I will check the conjunctiva. Could you please look up? Could you please look up? Thank you. The conjunctiva is pinkish with normal red vessels. After that, I will check the nerve 3 or oculomotor. First, I will check the size of pupil in both eyes. It is approximately 4 millimeter. They are round and equal and symmetric. And after that, I will do the test direct and consensual for both eyes. Thank you. And could you please step to pick up my pen? I will bring it close to your nose. And thank you. I did the test accommodation. The patient nerve 3 is contact, oculomotor is contact, and both eye pupils are equal. Equal, round, reflect to reactive to light and accommodation. After that, I will do the testing of ear. Ears are symmetrical and the appropriate shape. There is not any discharge. There is not excessive cerumen. And after that, I will check the nose is in the middle line. There is not any flaring. Sinuses, there is not any discharge or there is not any cross. After that, I will check the mouth and pharynx. For that, I see the lips are symmetrical. Also, they are moist. There is no sign of dehydration or lesion, and the color is appropriate. And for my patient is pink. After that, I ask my patient, could you please open your mouth? Could you please stick your tongue and say ah? Okay, with that, I check the nerve 9 glossopharyngeal and nerve 10 vagus. They were intact because the alveolar and soft palate rising up when he said after that, I will check the nerve 12 hypoglossal. Could you please stick out your tongue? Thank you. Could you please turn it right and turn left? And could you please say light tight dynamite?
Light tight dynamite.
Okay, this nerve 12 is intact because the tongue is in the middle and middle line, and also when he said light tight dynamite, there was not any tremor. After that, I will inspect the neck. When I inspect the neck, there is not any enlargement of thyroid visible, and also there is not any visible pulsation of carotid artery. There is not any scar. There is not any mass. After that, I will palpate the neck. For palpation the neck, I will go the back side and I will palpate. When during the palpation, do you have any pain? Okay, there is not any tenderness, and when I palpated, there was not any enlargement of thyroid, and also there was not any mass. There was not any swelling. And now I wanted to check the trachea. For trachea, one. Okay, the trachea is in the midline. There is not any deviation, and after that I will palpate the I will palpate the carotid but when I wanted to palpate the carotid artery and take the pulse, I will do that one by one. First, I will do that for 15 seconds, and then I will multiply that 4 times. That is 68, that in the range of normal. And now this time I will take and then multiply that to 4, that is 68. The carotid pulse was regular with strength normal, 2 plus was the strength, and it was equal bilateral. And after that I will do the test of nerve 11 spinal accessory. Could you please turn your head right hand? Thank you. Could you please shrink? Okay, now I want to apply resistance. Please turn. Okay, please turn your head. Okay, against my resistance. Now, could you shrink against my resistance? Thank you. Nerve 11 is intact because he can do all of this symmetrically and in a firm and same strength, bilateral and equal. And after that I will start to check the upper extremity. For assessing upper extremities, my patient has to expose upper extremities, and for upper extremities there is no deformity, there is no involuntary movement, both of them are symmetrical, there is no scar, there is no discoloration. Now I will start to palpation. If you have any pain, please let me know. Do you have any pain? No. And I check the temperature also with my back of my hand. The patient temperature was warm, and it was consist in whole body and bilateral. And also when I palpate, the bulk of the muscle was appropriate for this age, and also there was not any swelling or mass, and the skin was dry, and the moist was appropriate for this age. After that I will check the pulse radial, bilateral simultaneously. Could you please do like that? Okay, and for doing that I will do that in the same time, and I will do that for 15 seconds, and then I will do that 4 times. Thank you. It was 68, and it was the strength was 2 plus, and it was equal bilateral and regular. After that I will test the grip hand strength. Could you please hold my finger and squeeze as tight as you can? Thank you. This test was normal, and the strength was equal bilateral. After that I will go to lower extremities. For lower extremities I will check the in inspection the vein distribution is normal, and also there is not any scar, there is not a swelling, there is not a mass, and also there is not any involuntary movement in lower extremities, and also in lower extremities there is symmetrical. And now I will palpate the lower extremities. For lower extremities, when I palpate the lower extremities and check the temperature with my back of my hand, the temperature was warm, and it was consist in whole body. And after that I will check the the bulk of muscles was appropriate for this age, and there was not any tenderness or swelling. After that, I will check the thorax. Could you please turn for me? For thorax, could you please bring your head? For thorax, also my patient has to be exposed. For thorax, there is symmetrical. There is not any deformity like kyphosis or scoliosis. There is not any visible pulsation. There is not any scar. And after that, I will palpate for palpation and check the temperature. Temperature is consist in whole body, and also that is warm. There is not any dumping. There is not any sweating. The moist is normal and appropriate for this age, and also there is not any tenderness. Do you have any pain? There is not any tenderness or swelling or mass. After that, I will auscultate the back, but before auscultating, I will check the expansion of the thorax. Could you please breathe deeply in and out? Thank you. The expansion was symmetrical bilateral, and now I will do the auscultation. For auscultation, I will do that with a diaphragm. I will do that side by side and comparing side by side in 12 point. Breathe in, out, 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 in, out. I hear it wasn't clear. I hear the bronchovesicular and vesicular sound. There was not any wheezing or crackle or stridor. Could you please turn for me? Okay. And now I want to hear the apical and auscultation apical heart rate. For that, it is on mitral valve. First, I will find the landmark. I will go throughout the clavicle. I find the middle of that. This is the middle line, and then I will find the fifth intercostal area, and after landing mark, I will do that for 30 seconds, and I will multiply 2 for this patient. I check the apical auscultation in intercostal 5 in mid clavicle, and that I hear the 68 heart rate in apical heart rate. It was strong, normal, and it was equal, and it was I hear the S1, S2. I didn't hear any S3, S4. It means I didn't hear any abnormal sound. I didn't hear murmur, and only I heard S1, S2 normal sounds. And after that, I will do the abdomen. Could you please lie down there for me? I will check the privacy for my patient, and I will put one pillow under his knee, and I will drape all the body. Only the abdomen has to be exposed, and after that I will check the abdomen for abdomen in inspection. Abdomen is round, the umbilicus is in the middle, and in the middle line, and that is invert, and there is not any herniation, and also there is not any lump or swelling in the stomach, in the abdomen, and also there is not any scar in the abdomen. After that, I will do the auscultation. For auscultation, I will start from the lower right quadrant. I will auscultate the bowel sign, and then after that I will go to upper right quadrant, after that upper left quadrant, and then lower left quadrant. At these four quadrant, I hear the auscultate and auscultate the bowel sounds. It was approximately 5 to 30 bowel sounds, and they were gargling, cascade, and high pitch. And after that, I will start to palpate, light palpate. I will start that from the lower right quadrant. I will go to upper right quadrant, and after that I will go to left upper quadrant, and then left lower quadrant. The abdomen was soft and non-tender. There was not any tenderness. There was not any superficial mass. There was not any swelling, and also there was not any guarding. Thank you. Everything done. Thank you.